So order sets here. I just want to show you just a couple really quick and easy way things to go about things. So I want to do a lac repair. I want to hit done. I want the nurse to set up a laceration kit. I'd like them to do a wound care cleanse and irrigate, and I want 1% Lido with epi. And then also let's give them a Tdap. So basically through that order set, we've got pretty much almost everything set up already for them to get all set up in terms of that. Let's go through again, and like Dr. Goldman was talking about in terms of lumbar puncture as well. You have the lumbar puncture, you got nebulized treatments, pain protocol we already went through. The other one that also a lot of people use very heavily is the drips. So this is hopefully almost any drip that we can think of in the emergency department. Everything from an insulin drip to a Protonix bolus and infusion, octreotide, bolus here, and then infusion, labetalol for again the to titrate down in terms of blood pressure and heart rate. Again, it tells you all the different parameters. You have your cardine drips, diltiazem drips, and boluses. You got your amiodarone bolus and drips. You got your esmolol bolus and drips. You've got nitroprusside, nitroglycerin, heparin for ACS, heparin for pulmonary embolism. Again, it's trying to be all there for you so that you can just do a double click or one click. Your Versed, your propofol, and your ketamine, all for your intubated patients. So I'll give you a RAS of -1, so you don't have to mess with any of that. You got your becuronium bolus and drips for if you need to paralyze the patient. You got all your pressor drips as well, your Levophed, etc., dopamine, dobutamine. And then you get your bicarb drips. Again, so this is one of those things that these are all pre-mixed, all ready to go. And then also your Tylenol overdose as well down here for your 3 different steps that you can go through.
Just one question. All of these are obviously, a lot of these are weight-based. In actual live environment, if there's actual weight on that patient, will it automatically import that weight, or are you going to have to manually put that in?
Yeah, it'll put in that weight. It may still pop up here. It may say, dosing. If the patient's 90 kilos, I'm just saying 90 for the sake of example. It may say it may pop up the screen, and you'll just say and not have to put in anything and just hit OK. But it will automatically put that in. Again, since this is a test patient, it does not have that. But very good question. But yeah, it should import everything. But it may ask you with this patient being, especially for that 250 kilo patient or something like that, again, and there are hard stops as well that'll say max dose of this is 2 grams or whatnot as well.
Excellent.
And then the last thing I wanted to show you as well was again then the EMP, the pediatric portion of things. Neonatal fever is basically, this is all set up for your kiddo less than a month old, has your chest x-ray, blood cultures, urine, LP, antibiotics already ready to rock and roll. Your abdominal pain with ultrasounds for pyloric stenosis, for your intussusception, evaluation, cough, shortness of breath, asthma stuff, just your general illness is kind of like your all-inclusive thing. And then we also have a lot of kiddos just come in for PO challenge as well. So you can just literally, again, just try to make this quick and easy. It's already got your PO challenge in there. You can put in whatever Zofran you'd like for your ODT if that's your medication of choice. Scroll down and do your Advil suspension again and it'll pull up 10, again, hopefully not 90 kilos for this one, but let's just say 20 kilo or something of that nature, and it'll pull up 200 mLs, and you can hit done, and now you're ready to PO challenge the patient, and again, if they otherwise have a very benign exam, they're going to be ready to go once they finish that PO challenge, and the nurse can let you know about that. So.